What is considered a border between upper and lower respiratory tracts? So when the question is stating border, think of something that like separates or divides up the upper and the lower respiratory tracts. So we want to separate out here. These are all of the parts of the upper respiratory tract, and then below we'll pick a different color. This is all part of the lower respiratory tract. So lower and then upper. So we want to find which of these choices would be the dividing part, or the area that would be between separating the upper and the lower sections of the respiratory system. So option A is stating the pharynx, and the pharynx is located right here. The pharynx is your throat. So we see that that's part of the upper respiratory tract, and that there's still other parts that are a little bit lower before actually getting to the official lower respiratory tract. So this wouldn't be the border, so we could eliminate option A. Option B are the tonsils, and the tonsils you can't exactly see on this diagram, but these would be two features that are in the back of your throat, kind of like this, that you might have in the back, and they become inflamed if you have a respiratory infection. Sometimes it can become chronically inflamed if you have a lot of pharyngitis or sore throat or strep throat. So you can't exactly see it on this diagram, but it's usually when you open a patient's mouth, when they open their mouth, it's in the back of their throat. So you can kind of see it all the way toward the back, and they go down. So that wouldn't exactly be the border between the upper and lower respiratory tracts, so therefore we can eliminate option B. The tonsils would be considered part of the upper respiratory tract, so we can eliminate that. Option C are the vocal cords, and you might note on this diagram that the vocal cords are your larynx, and the larynx would be located right over there. You can remember that the larynx is the voice box or the vocal cords, because if you think of someone who has laryngitis and their voice is very raspy, they might sound like this because they lost their voice. That would be laryngitis related to the larynx, which is the voice box or the vocal cords. And as you can see in this diagram, the larynx is the last feature of the upper respiratory tract before it becomes the lower respiratory tract, and therefore this is likely our answer of what is considered the border between the upper and lower tracts, and we would go with option C. But just to be sure, let's take a look at option D here, the epiglottis. And the epiglottis, that's in the back of your throat. That is the flap that separates between the respiratory system and the digestive system. So when you're breathing, we want air to be going in and out to your respiratory system, but we don't want any food particles going into your lungs when you eat. So the flap closes to prevent any food from entering the lungs. And this would be located right over the larynx. And it might be hard to see. It's this little flap right there. So it'd be right before the larynx. So close to the border, but not exactly the border itself. So we can eliminate option D, the epiglottis. The vocal cords or the larynx would be your best answer of what is the border separating the upper and lower respiratory tracts.